Hi, I'm Dr. Mustafa Ganiji, founder of Alpha Male Clinic. If you're watching this video, chances are you've been thinking about penis filler for a while, but you want clarity before taking the next step. That's completely normal. Most men who reach out to us aren't impulsive. They've usually been sitting with this quietly for months, sometimes years. The purpose of this video is to act as a virtual consultation. It's the same conversation I would have with you if you were sitting in my clinic. No pressure, no hype, no exaggerated promises. Just clear medical information so you can decide whether this treatment is right for you. By the end of this video, you should understand who this treatment is for, what it can and can't do, how safe it is, what recovery will look like, and what the next step would be if you decide to go ahead. Let's start with who penis filler is actually for. The ideal candidate is a healthy adult man who wants a natural, proportionate improvement in girth or flaccid appearance. Most of the men I see fall into one of these three groups. First, men who have always felt slightly self-conscious, even though they're technically average in size. Second, men entering new relationships or dating again, who want to feel more confident and relaxed during intimacy. And third, men in their 30s, 40s, or 50s who want to feel more balanced and more like themselves again. What this treatment is not designed for is extreme size changes or chasing unrealistic ideals. Penis filler isn't about becoming someone else. It's about restoring confidence and comfort in your own body. Now let's talk about something most men don't openly discuss, but which matters more than anything else. Most men don't usually seek penis filler treatment because of vanity. They seek it because of confidence, particularly private confidence. Locker rooms, intimacy, new relationships, or just comparison. These moments shape how a man feels about himself quietly over many years. I see highly successful men every week, confident at work, respected socially, but still carrying this one private insecurity. And over time, that internal doubt can affect relationships, self-esteem, and even how a man carries himself day to day. This treatment isn't about numbers or measurements. It's about addressing something that's been sitting quietly in the background for a long time. One of the most important things to understand is what penis filler does and what it doesn't do. Penis filler increases girth and it can improve flaccid hang, but it does not increase the erect length. The filler sits under the skin around the shaft. It does not go into the erectile tissues and it does not interfere with erections or sensation. When expectations are clear from the beginning, satisfaction rates are high. When expectations are unrealistic, no treatment will ever feel good enough. My role as a doctor is to make sure you understand exactly what you're choosing so there are no surprises later. Safety is usually the biggest concern, and rightly so. Penis filler is a medical procedure. At Alpha Male Clinic, it's treated with the same level of care, sterility, and professionalism as any other medical treatment. I use medical grade hyaluronic acid filler. This is body compatible material with a long safety history in medicine. The treatment is temporary and reversible, which adds another layer of reassurance. Most of the complications happen when patients don't follow aftercare instructions or have sex too soon. Other complications you read about online come from non-medical providers using cheap fillers, injecting in the wrong layer, or lacking anatomical knowledge. As an added safety measure, each patient is given a course of antibiotics before and after the procedure to minimize the chance of infection. Proper technique, correct placement, and medical oversight are what makes this treatment safe. That's why doctor-led is essential. Aftercare and treatment reviews are included in your treatment costs to address any concerns after the procedure. Let me now walk you through what actually happens on the day of the treatment. The procedure takes about an hour. We would normally start with a strong numbing injection of local anesthetic to make the area completely pain-free. Comfort is always prioritized. The area is prepared under sterile conditions using a fine cannula. The filler is carefully placed along the shaft, ensuring even distribution and a natural shape. There's no surgery, no stitches, no hospital stay. Most men drive home themselves afterwards and describe the experience as far easier than any other procedure they have had. Now let's spend a bit more time on recovery and results, because this is where a lot of anxiety sits. Straight after the procedure, it's completely normal to experience some swelling, firmness, or mild tenderness. This isn't a complication, it's simply your body responding to the filler and the injection process. For most men, this settles significantly within the first few days. During the first week, the penis can feel slightly firmer than expected. This gradually softens and the filler integrates into your natural tissue. By around 2 to 3 weeks, things feel much more natural, both to you and your partner. In terms of aftercare, to keep it simple but important, you will be provided with a comprehensive PDF where we advise supportive underwear, avoiding sexual activity and vigorous pressure for around 2 weeks, and just to perform gentle massage to ensure that the even shape remains until the filler sets. This helps the filler settle evenly and give the best aesthetic outcome. Now let's talk about results in a realistic way. Most men see an average increase of around 1.5 to 2 centimeters in girth per session, depending on starting anatomy and volume used. For the average 6-inch penis, 20 mil can add 2 inches of girth. Some men choose to build gradually over 2 sessions rather than doing everything at once, and medically that's often the best approach. Flaccid appearance tends to improve immediately. Many men comment that their penis looks fuller and more substantial at rest, which is for some is just as confidence boosting as the change during erection. Results are not instant and final on day one. They evolve. The final settled result is usually best judged around the 4 to 6 week mark in terms of longevity. Hyaluronic acid fillers typically last between 12 and 24 months. The body breaks them down slowly over time, so results fade gradually rather than disappearing suddenly. Many men choose a maintenance session to keep things consistent once they see how it feels to live with the result. Now, I want to address the fears most men don't always say out loud, but are absolutely thinking. The biggest one is, what if it looks fake? When penis filler looks unnatural, it's almost always due to poor technique, overfilling, or inappropriate product choice. In a doctor-led setting, the aim is proportion, balance, and symmetry. I'm enhancing what's already there, not creating something exaggerated. The filler sits under the skin and moves naturally with your body. Once settled, it doesn't feel rigid or artificial. Most partners can't tell unless they're told, and many simply don't notice increased confidence rather than focusing on appearance. Another major concern is function. Penis filler does not go in the erectile tissue. It sits outside the chambers responsible for erection. That means erections, sensation, orgasm, and fertility are not negatively affected. There is no change to those. In fact, patients have reported having filler on the outside gives more pressure to their chambers, leading to a firmer erection. Many men actually report intimacy improves, not because of a mechanical change, but because their confidence and their reduced anxiety and distraction. Let's talk about pain. With proper numbing and local anesthetic, discomfort is minimal. Most men describe the experience as pressure rather than pain, and many compare it to being even easier than a dental procedure. and they're very surprised by how easy it was. Privacy is another major concern for some men. This is a discrete treatment with discrete result in a discrete location. There are no visible scars, no external signs once healing is complete, and no reason anyone would know unless you choose to tell them. And finally, there's the deeper fear. What if I regret it? This is one of the reasons hyaluronic acid filler is such a good option. It's temporary and reversible. If for any reason you weren't happy, the filler can safely be dissolved. That safety net allows men to move forward without feeling trapped by making a permanent decision. If you're still watching at this point, that usually tells me something important. Tells me that this treatment resonates with you. The next step isn't booking treatment straight away. It's having a private consultation with me where we can confirm the suitability and answer your specific questions and make sure that this is the right decision for you. There's no pressure. My role is to guide, not to persuade, and I hope you found this video useful. You've already taken the hardest step by looking into this properly. Everything after that is just a conversation if you'd like to take the next step. Simply reply to this message or book a consultation using the link provided, and we'll take it from there with a discreet, professional, and at your pace. Thank you.